Foley catheter insertion procedure. A Foley catheter is a device that drains urine from the urinary bladder into a urine bag outside of the patient's body when you can't pee on your own or for various medical reasons. A Foley catheter is also said to be an indwelling urinary catheter. Foley catheter insertion. Step by step 1. Gather all the supplies. Foley catheter, sterile gloves, lubricant gel, antiseptic solution sterile, drape syringe. 4. Inflating the balloon, sterile water. 2. Inflate the balloon. Collection bag. 2. Prepare the patient before starting the procedure. The nurse or doctor will explain the entire procedure to the patient. Give the patient the proper position by having him lie on his back with his legs slightly apart. Place a sterile cloth on the patient's lower body. Ensure patient is suitable and consents. 3. Clean the area. The nurse will wash her hands thoroughly, then put on sterile gloves. Clean the urethra and the surrounding areas with a cotton ball dipped in antiseptic solution, from front to back for women or from tip to outside for men. 4. Apply lubricant. Apply lubricant during Foley catheterization with water-soluble jelly to the tip of the catheter liberally for ease insertion. 5. Insert the catheter. Male catheterization. For inserting catheter, the male urethra is longer as compared to the female urethra. A catheter is placed while the patient is lying down or in the frog-legged position. If there is a foreskin, it is retracted to its maximal limit before the catheter is gently inserted. Female catheterization. For inserting catheter, the female urethra is short compared to the male urethra and is located above the vagina in the pelvis. Insertion of the catheter is facilitated by having the patient lie down on her back with the buttocks at the edge of the examination table. To provide adequate exposure of the urethra is obtained by elevating and supporting the legs by stirrups or placed in a frog-legged position. Finally, the labia are separated to expose the urethra for allowing catheter insertion easily. Advance the catheter 2 to 3 inches until urine starts to flow properly. Once urine starts to flow, advance the catheter another inch. 6. Hold the balloon inside the bladder. To inflate the balloon, attach the syringe filled with sterile water to the catheter port. After inflating the balloon holds a catheter tube inside the bladder. 7. Secure the catheter. Gently pull the catheter back until resistance is felt to make sure the balloon is seated in the bladder. If the catheter is stuck, the balloon is firmly seated in the bladder. Secure the catheter on the patient's thigh using tape to prevent it from moving. 8. Attach the collection bag. At the end, check the catheter is connecting to the urine collection bag properly or not. Place the bag below the level of the patient for proper drainage. In the hospital, the urine drainage bag will be hung on the bedside railing by a hook on the bag. Thank you.